Hello dear students, welcome back to your science classes. How are you all? I hope you all are healthy and doing well. So students, I'm your science educator again here with a new chapter and a new concept. And today we have chapter number 8, safety and first aid. So now we have a question. Why there is a need to learn safety rules and first aid? Because if we know about the safety rules, so we can preserve ourselves, we can prevent ourselves from the injury and from the accidents. And if after following the safety rules, if we have small and some kind of other accidents, so how can we use first aid so we can protect ourselves till we reach to the hospital. So all of you students, this is a very important chapter for you. So all of you students, this is a very important chapter for you, so you have to keep in mind these safety rules. Okay, let's get started. But before starting this chapter, we have to look on our learning objective. So first, safety at home. Next, safety at school, safety at the playground, safety on the ground, and first aid, some basic rules for the first aid. So, let's get started. You have already learned about safety at home, at school, at playground, while moving on the road and traveling in vehicles. In this chapter, you will learn some more precautions to be taken to avoid injury or accidents. Some common injuries and first aid given for such injuries. So first of all, we are going to learn about the safety rules at home. So what are the safety rules we have at home? Be careful while using knife, forks, scissors and other sharp things. Safely store appliances with sharp blades such as blenders and food preservers and insecure locations. Keep all tools including those for gardening, automotive work and lawn care in closed cupboards or cabinets when not in use. So what are the things we have to keep in mind while we are in a home, that we have to avoid the play with the sharp things, for example your forks, for example your knives. The first thing is this. Next, you always keep in your mind that your mother should be protect these kind of items in a secure space, in a safe space, in a cupboard basically, so your hands and you cannot hold them with and you cannot get to it. Next things which you have to consider in your mind, that this is the sharp things. Next, you have to avoid the use matches, lighters, chemicals and lit candles with care, following safety guidelines, and ensure that all wires in temporary lighting setup are properly insulated to prevent electricity hazards. When playing with electronic toys, be alert for any sparks, excessive heat or unusual smell. Such toys must be repaired or immediately discarded immediately. Exercise cushion using electric irons to prevent accidents and burns. So now what are the next things we have to keep in your mind, that we have to keep in mind that you have to avoid lighter, the fire catchy items basically, your lighter, your matchboxes and your chemicals. These are the things which will be give you any kind of harm, any kind of injury, so it will result into that. Now what are the other things which we have to keep in mind, that while you're playing with your electronic toys, so always keep in mind the temperature of that particular toy or any kind of smell coming up from that particular toy. So if the temperature increases or any kind of smell you smell, then you should have to avoid playing with that toy and you have to immediately discard it. Next thing, exercise cushion using electrical irons to prevent accident and burns. And always keep in mind that you have to avoid yourself from the iron. Next things which we have to keep in mind, that avoid fireworks or sparkles at near your home. Always keep in mind, don't firecracks or sparkles in your home. Do this. This is an outside activity, so you have to perform outside of your home. Next, never try to make your own fireworks. Do not hold fireworks in your hand while lighting them. Never carry fireworks. Never carry fireworks in your pocket as friction can trigger them. Do not throw or light in crackers carelessly. Light only one cracker at a time. Never drink too hot beverages or soups. Always check their temperature with a spoon before drinking. Avoid sliding down banisters or running downstairs to prevent falls. Now, what are the things, other things which you have to keep in mind, that if you are a fire lover, okay, so what you do, you have to keep in mind that you do not use fire by taking in your hand. If you want to crack a firecracker, so you have to take it one at a one time. You have to do this activity outside of your home, and you don't need to first you crack it and then you just pull out of the window. So you have to avoid these things. Next things, never drink too hot beverages, always first check the temperature of the beverages with the help of a spoon, and then you have to drink it. Avoid sliding and go slowly on your stays. Okay, don't sliding, don't do these things when it will be result into the fracture of your bones. Okay, now refrain from flying kites with standing on a terrace. Use a ladder to reach high objects instead of climbing on chairs, tables, and boxes. Ensure good lighting through your house for safety. Consider using night lights in bedrooms and bathrooms for added safety. Keep toys, shoes, and other objects off the floor to prevent tripping hazards. So what we have to keep in mind, that if we have to take we have to cross the high object, so we have to choose the ladder for this. We do not jump all the time. Okay, or if you are flying your kite, so you have to keep in mind that you should be avoided the boundaries of your terrace, otherwise you will be fall down. Next thing which you have to keep in mind, that your toys should be at the place of toys, your other shoes, your socks should be at the place of there only, otherwise it will be result into the tripping hazard. So these are the safety rules which we have to follow when we are in our home. Now we are going to learn about the safety rules which we have to follow while we at school. So what are the safety rules? Do not rush to go to the next class or to go home. Do not run in the corridors. Do not crowd or shove. Never throw paper or other objects on the floor where someone might slip on them and fall. Never take two or more steps at a time on stairs. Do not throw items such as pencils, pens, books, or paper clips at other students. Do not push or crowd when entering or leaving a classroom. So what are the things which we have to consider while we at school? That you do not run in corridor. Okay, it will be result into the your slippery and you fall down and your bone will be fractured. First thing. And if you want to go outside, if you want to go from one class to another class, if you this is the time of your lunch break, this is the time of your bell, that this is the time for go to home. So always keep in mind, you have to slowly come out from your class, and then you have to move to another class, then you have to move forward to your home. These things. Next thing which you have to keep in mind, that you should avoid the throwing process of pencils to other students, which it will be hurt the other student eye as well. Okay, so always you keep in mind, this type of games is not good while this type of games is not good to play in the classroom. Now other things, do not push other students. Always keep in mind, you have to take and always keep in mind, you do not push other students, and you always have to follow the staircase. You have to you have to walk slowly. Don't run in a rush, otherwise you will be fall down. Now we are going to learn about the other safety rules which we have to follow at the park and playground. Safety at the park and playground. Ask an adult in the playground and make sure that the equipment you are going to use is safe. Always keep in mind, first you have to check the safety for the tools, equipment you are using for playing. If an adult ensure that it is safe, then you have to use it, otherwise no. Use the playground equipment properly. Don't make a jumble of your equipments in the playground. Play with it sincerely, accurately. Okay, always play in playground. The playground surface should be free of standing water and debris. There should be no broken materials like broken glass or twisted metal. So always keep in mind, where you play, you have to consider that that place is clean and there is no collected water or any kind of broken glass or metal, otherwise it will be hurt you. Now never push while all jungle gyms, slides, seesawing swings and other equipment slide fit. First, do not climb outside the guardrails. Do not stand on swings. Leave bikes, bags, etc. away from the equipment and the area where you are playing, so that no one trips over them. So what you have to keep in mind, if you are using a seesaw, to using it in a sincere way. Don't make it a jumble of this. Okay, and other things which you have to keep in mind, you have to slide it properly. You have to follow the rules and regulations for playing properly, and you don't have to. There is no need to stand in the front of others' space. So play but properly. Now do not use playground equipment if it's wet, because moisture causes the surface to be slippery. Always keep in mind, if your equipments are wet, so you have to avoid the use of it. Always sit on the swing. Do not stand or kneel. Never ride a swing with more than one child. The things which you do, two or three child are one swing and they are doing round and seesaw. So always keep in mind, you have to avoid this. On a seesaw, always sit facing one another, not turn around. Too many children on the equipment one time can be dangerous. One equipment, one children, and if we have seesaw, so two children at one time, that's it. More than two, more than three on a single equipment, it will be dangerous for you. So please students, keep in your mind, and you have to follow this rule while you play. Next thing which you have to keep in your mind, the safety while swimming. So what you have to consider, never swim without as adult supervision. Always keep in your mind there should be adult who advise you, who supervise you, and then you have to swim. Always swim in a clean and protected pool. Do not go to the deep side of the pool. Do not go for swim just after your meal. Do not go for swim if you're suffering from cough or cold. So what are the things which we have to keep in mind? If you are done your dinner, if you're done with your lunch, and then after immediately you're going for swimming, so you have to avoid this. You have to avoid swimming if you have a disease or cold, or you have to always keep in mind that you don't go too much deep into the pool. Do not push anybody into the water even just for fun. Wear proper swimming costume when you are swimming, and always keep in mind you have your equipments, you have your costume while you go for swimming, and do not push anybody just for fun. Okay, now the other things which we have to follow, the safety rules for the road safety tips. Always remember to stop, look, and listen before crossing the road. Always keep in your eyes left, right, okay, and then you have to cross the road. So these are the things which we have to follow. When crossing at crossroads or intersections, look both ways and exercise caution. Even with a green light at an intersection, continue to look in all directions and watch for running cars. Never run across an intersection. So while you cross an intersection, what things you have to consider, that first you have to see right, then you have to see left, and then you have to cross it. And always keep in mind, don't be in a rush while you cross the intersection points. Okay, avoid crossing the roads between the parked cars. While when walking on roads without sidewalks, always walk on the side of the road facing traffic as close to the edge as possible. Stay away from ditches and ponds for your safety. If you have a siren, move to side of the road as far as possible. Stop and wait until the emergency vehicle, example ambulance, has passed. So always keep in mind, if you are intersecting and you have to cross it, but in that way ambulance is coming, so you have to follow that ambulance silence, and you have to give time, you have to give space for crossing, for pass away for the ambulance. Never walk along on railway tracks and bridges. Your question, when crossing railroads tracks, and avoid doing so when it's prohibited. So always keep in mind, you don't have to cross the rail racks, okay, rail road, because it is very very dangerous for you. And if you want to cross it, so you have to take questions from an adult, then you have to do this. Seek immediate indoor shelter during thunderstorm for safety. Avoid playing with or throwing balls while walking on the road. So always keep in mind, you don't have to play on the road. Play is made for the playground, so play only playground, only in playground. And never get into a car with a stranger, and always inform your parents when where you are going. Try not to go alone at night, especially in unfamiliar or poorly lit areas. So what we have to consider and what we have to keep in mind, then we have to always ask our we have to always tell our parents where we have to go and how we are going. Never ever sit on this stranger's car. And the other things which we have to consider, that you have to go, do not go outside lonely and without so what you have to go, you have to avoid go outside at night time alone. Now we are going to learn कुछ कहना है? Now we are going to learn about the next topic, which is first aider and first aid. What the things which we have to keep in mind for the first aider? The first person who provides assistance to an injured individual until medical treatment can be administered as is known as the first aider. The immediate assistance given to an injured person before they receive medical attention from doctor is referred to as a first aid. For example, if there is an injured person and I proceed with some kind of aids to it, that is, so I am referred as the first aider, okay, because I am proceeding with the first aid. The things which we have to do for the injured person when he just far away from the doctor or hospital, that is referred as your first aid processes. Now, these definitions succinctly describe the roles and purposes of the first aider and the practice of the first aid. First aid is about using common sense in ways that keep the injured person without harming him. It is a great idea to do a first aid course so that one can learn what to do, help others in an emergency. So in emergency process, we are using our common sense in such a way so we can save the injured person we can save a life and we can take away from big dangers. That's why we are using our common sense and we apply the first aid. And First aid is a very interesting and very important course for each and every person, so he or she know what we have to do at these emergency moments. Now, basic rules for first aid: analyze the situation quickly and decide if you can provide assistance to injured individual. First of all, you have to analyze it is your cup of tea or not. If you can do it, so you have to do, otherwise stay away from it. You have to consider and you have to proceed with a experience or a adult person, then you have to do this. Okay, if you believe you can help, initiate first aid properly. If you see, okay, it is your cup of tea, then you have to proceed properly. Call a doctor or an ambulance for professional assistance. Always keep in mind, you can do your work, but between that you have to call a doctor or a professional assistance too for the proper care. If the injured is bleeding or has stopped breathing, prioritize life-saving treatment as a first aider. So if the bleeding is there, if the person is not taking breath, so you have to proceed with the first aid, the initial first aid things related to this. For example, you have to tap the, you have to bandage this bleeding part, or you have to give CPR for the breathing process. If the injured person is in hazardous locations such as the middle of a road, move them to a safe place. So keep in mind, if the person is in dangerous place, first of all you have to take it in a safer place. Do not attempt to move the injured person of your suspect they have a broken bone or internal injuries. So always keep in mind while you take a movement, so it is properly safe, because it could be any fracture which will be result into the further problem. If the injured person is unconscious, gently turn their head to the side to prevent choking on the blood, saliva, or vomit. So always keep your mind that if the person who injured person is unconscious, then you have to turn their head to their side to prevent choking or blood, saliva, or vomit. If the injured person is conscious, inquire about what happened and where they are experiencing pain. Check if the injured person is breathing by observing chest movement or listening for airflow when placing your ear near the mouth. So what you can do, first of all, if the person is conscious, so he wants to ask the question like, oh, I'm paining, who are you, where I am. So you have to first calm him or calm her. Then you have to check it is properly breathing, or any kind of injuries they have. First of all, you have to check it how many injuries they have, it is properly breathing or not. Or if the person is unconscious, then you have to check your ear on your on her chest, and then you have to listen the heartbeat. If it is properly run, so it means the person is alive. Or the second thing you can check, you take your finger near his nose. If the you feel the air, then it is also mean that the person is alive. Assess the pulse to monitor the person's vital signs. Speak calmly and reassure the injured person to provide comfort and support, and give him or her calmness that okay, fine, you will be fine, you will be fine, like this. Don't make it a dangerous or a calmless situation. Okay, and always make sure that the injured person should be away from the crowd. Okay, now let us now learn what aid must be given to people who have met with simple accident resulting in cuts, bleeding, nostrils, burns, fracture, and insect bite. So how we have to perform if the person is suffering from these types of diseases, these type of injuries. So first, cuts. Many cuts can be safely treated at home without basic first aid. However, it is crucial to recognize that large and deeper cuts or any wounds that do not stop bleeding require immediate emergency medical treatment. So most of the cuts are little bit, so we can avoid them, and we cannot, there is not a need. So or we can heal it with the basic first aid tricks. But if you have deeper cuts and the blood it's not stopping, continuous bleeding is happening, then you have to consider a supervision of the medical expert. Now, what to do? If the cut is severe and you cannot take the injured person to a hospital or have a wait for an ambulance, begin the first aid right away. Rinse the wound with water. Apply pressure on the cut with the sterile gauze and bandage or a clean cloth. If blood soaks through, place another bandage over the first and continue applying pressure. Raise the injured body part to slow down bleeding. When bleeding stops, cover the wound with a new clean bandage. So what you have to do, first of all, you have to rinse it, okay, with the help of water, the deeper cut. If there is no, if you are waiting for the ambulance or there is no medical treatment you have, so first you have to rinse with the help of water. Then you have to pressure that part, the away part from the cut, and you have to put the bandage on it. When you feel okay, fine, the pressure part is complete, then you have to cover it with the help of a new bandage. Now, nosebleed. So all they can be scary. Nosebleeds are common in children age of 3 to 10 years and usually are not serious. In fact, most nosebleeds stop on their own and can be treated at home. So most of the nosebleeds are not that much serious as we think. It could be simply handled at the in the home only, at home only. So what you have to do, make the child sit up with his or her head tight tilted slightly forward. Do not allow the child to lean back. This may cause coughing or vomiting. Pinch the soft part of the nose just below the bony part for at least 10 minutes. Call a doctor if the child has frequent nosebleeds, has put something in his or her nose, has heavy bleeding accompanied by dizziness or weakness, continuous bleeding after 2 attempts of applying pressure for 10 minutes. So what you have to do, first you have to consider that your child, first of all, the children first of all the child should be sit properly. Then you have to take their head to tilt it away, and this soft part of the nose you have to press it for 10 minutes. If this helpful for you or it stops the nose bleeding, fine, it's good. Otherwise, if it's not stopped, so what you have to do, you have to take the supervision of the medical expert. Okay, and what you have to do, you have to take supervision of the medical experts, and you have to cover his mouth with a hanky, with a clean hanky or with a clean tissue paper. Okay, so it will help him. And always keep in mind, at that time the person get a faint as well. So always keep in mind, you are providing a good support to him or her. The next thing, when we have burns from fire or other sources of heat range from mild to life threatening. Some burns can be treated at home, others need emergency medical care. So some small burns can be treated at home, but if the burns is big or dangerous, then you have to take a supervision of the medical expert. So what types of burns we have? The first degree burns, they are usually caused by brief contact with heat. They can cause redness, pain and some swelling. So this is first type of first degree burns, when we just get contact with the heat and we have a redness and pain and some swelling on our the part which is get in touch with the heat. Now second degree burns, they are more severe and usually result in blisters and more intense redness. So sometimes when you have a direct and a long time connection with the heat, so it will result in the blisters, and the redness of that burn is intense, and the redness as well. The third degree burns, they are the deepest and may be painless due to nerve damage. So when you have third degree burn, it means your nerve is damaged, and that time you have to take a supervision of the doctor. In both the cases, secondary and third degree, you have to consider a doctor for proper consultation. Now what to do if you cannot take the injured to a hospital immediately or have to wait for an ambulance? Initiate first aid properly. Remove clothing from the burned areas. Clothing stuck to the skin. Run cool, not cool water over the burn until the pain lessens. So what you have to do, first of all, you have to remove the clothes of the person, so the cloth cannot stick on the skin, right? The second thing you have to do, then you have to run cool it, okay, and not put water directly into it, just you have to make it cool. Do not put ointment, butter or anything else on the burn. This can make the burn worse. Light apply a gauze bandage if it's small first degree burn. If it is a second degree or third degree burn, seek medical care immediately. If the first degree burn, then you can do first aid. Otherwise, third or second degree, you have to take a supervision from a expert. Now we have broken bones. Broken bones are not uncommon in children, especially after a fall. A broken bone require emergency medical care. A broken bone is painful and cannot bear any weight on the injured area of movement. Broken means your bone is break. So this type of things are happen with the children when they fall down. So this is a very uncommon thing with children. So now what to do? Remove clothing from the injured part, so you can easily identify, okay, which part is broken, because which part is broken, that have a swelling. Apply cold compress or ice pack wrapped in cloth to reduce swelling. You can take ice in a bag or in a pack or wrapped it, and you have to use it upon your swelling part. It will help you to reduce pain. Let the injured limb remain in the position you find. Always keep in mind, if there is a fracture, you have to keep that part in that direction only. Don't change it, and do not move the injured if the hip has serious head, neck or back injuries. If we have head, neck or back injuries, so always keep in mind, don't move that person. If a broken bone has come out through the skin, apply constant pressure with a clean gauze. pad or thick cloth. Keep the injured lying down until a doctor or a medical help arrives. Do not wash the wound or push in the bone that is sticking. Go out. If you see in the bone is outside of the skin, so what you have to do, first of all, you have to make sure that the position is not change of the person, and the second thing, you have to take a medical supervision of the expert, and you have to wait until, and you have to keep in mind the position of the person should be same. Insect sting, insect bite. Although insect stings can be irritating, symptoms usually do not require treatment by a doctor. However, children who are highly allergic to insect stings may have life-threatening symptoms and may require emergency treatment. So you always seen that bee can sting it. So in bee sting, it having acid, methonic acid, which will lead to redness and irritation. So in that case, what you have to do, some kind of insect biting can be proceed with the basic first aid. Otherwise, you have to consult with a doctor. So signs for severe allergic reaction: swelling of the face or mouth, difficulty in swelling or speaking, chest tightness or difficulty in breathing, dizziness or fainting, abdominal pain, nausea or vomiting. So these are the symptoms we have for the severe insect biting. Now what you have to do, remove the child from the area where he or she was stung. If the child was stung by a honeybee or wasp and the stinger is visible, remove it by using a clean straight edge object like a credit card. So what you have to do, first of all, you have to take your child away from that place. Then you have you if you able to see if if the stinger is visible, so then you have to try to remove it from the skin with the help of a needle, with the help of a credit card. Now wash the area with soap and water. Apply ice or cool wet cloth to the area to relieve pain, itching and swelling. If the area is itchy, apply some medicated cream. If the symptoms are serious, call a doctor or medical help immediately. So what you have to keep in mind, if the stinger is visible, you have to remove it. After this, you have to clean it with soap and water, and then you have to cool it with the help of a ice pack, or you can use cold water as well. And if the itchiness is reducing, then it is good. Otherwise, you have to consult with the doctor immediately. So students, this is the end of your chapter. I hope so you like this chapter and understood it very well. Now I'm going to meet you in your next class. Till that, bye bye. Have a good day.